as of today, let me say first, I want to thank Londoners for the tremendous support that they have shown through this COVID crisis. One thing is clear that Londoners understand what the issues are, but the implications are still to be played out. This is not just a London crisis, as people know, and it's not just national; it's international, and the whole world is responding in different ways. It's partly why we heard today from the Prime Minister. We'll hear from him likely every day as a result of different initiatives that are rolling out, but some major initiatives were announced today. We know that the province of Ontario has declared a provincial emergency. And as a result of that, certainly at this time, it's not London's intention to declare a municipal emergency because we're covered through the provincial jurisdiction of that decision. And as a result, we're going about what we need to do. We have a group of some of the strongest leaders in first response and first responders and hospital care and our transit commission and departmental managers, everything from our police to our fire to our EMS, meeting consistently to be able to deal with the issues at hand. And we're talking about how all of the various departments are dealing with this in terms of frontline services to ensure that we take care of London's most vulnerable. We're putting plans in place to be able to accommodate those who are homeless so that we can give them isolation space as need be. Those plans are being developed and will be announced as they're ready. We've got a great cooperation from our member agencies as well, working with and through the city to ensure that we take care of London's most vulnerable. And some of the announcements coming out of the federal government even today speak to the issue of what the steps are going to be taken, at least from a financial standpoint. It's clear that the federal government has significant firepower and financially, and they intend to use it. And I think that's very necessary at this time because we're in a unique circumstance. People will know that the Emergency Operations Center was convened when we had the Woodman explosion in London last August, and they handled this with precision like care. This is not the same circumstance. It's wider, it's deeper, and longer lasting. And we don't know when the end of this crisis will be. That's why we're taking the unprecedented steps that we are at all levels of government to ensure that we have the supports that London needs and other communities certainly that they will need to be able to deal with this. One of the simple things but absolutely critical things is, do we have sufficient supplies? And while I'm confident we have a number of weeks of supplies to be able to accommodate the needs of our first responders and their patients and those affected, I'm talking about supplies like masks, swabs, cleaning material, potentially respirators, issues that are impacted by communities, felt by communities right across the country. And in that regard, the Deputy Prime Minister had a broad big cities mayors phone conference last night, and we discussed what those needs are across the country. And we're going to be providing some inventory requirements over the next 3 and in fact 12 months, just to ensure that we ensure every eventuality is considered. It's prudent, and it's our obligation to support Londoners, particularly at this time. So from a needs standpoint, there's things like basic supplies. There's for the homeless to be able to provide accommodation for them when self-isolation is required, and to be able to do that humanely and promptly. So that's what we are in the process of developing right now. This crisis has been developing over a number of weeks, and in fact, we've got several individuals in London who have been impacted by the COVID virus, and those are being dealt with through the Medical Officer of Health, who also participates in our daily Emergency Operations Center discussions. So we're confident that with that support and with the support of our hospitals and the most recently opened facility at Oak Ridge Arena, where people who are concerned can be tested at the site. It's a drive-through type facility, and if it requires Anything beyond being satisfied that their condition is fine, then we will take appropriate action. With respect to the other side of this, one of the things that we're quite concerned about is issues around the around the issues of the business climate. Business people are rightly concerned. You'll note that on St. Patrick's Day, restaurants and bars voluntarily closed, and as such, we are grateful as a community for their observance of this request from the medical officer of health. And businesses are trying to do their part. You would have recently heard that Loblaws and Shoppers, to name one company, is offering specific times in the mornings for seniors to come shop without other shoppers being there. Certainly elderly people, as well as those with underlying conditions, are quite susceptible to the COVID virus. And I think that showed great leadership on their part. You'll note that there is a motion that is going through council fairly soon to discuss waiving of interest and penalties on interest on late payments, and Hydro is doing its part as well in that regard. Also, in front of council will be the issue of businesses and homes that have taken loans out with the city for improvements when their properties usually are and typically are connected to a municipal property, and they're looking for certain improvements, and we have programs associated with that. Again, looking to waive any late payment fees or interest fees associated with those commitments. So that's in front of council, and we're reviewing a number of options that we can consider. That will include as well economic impact and recovery task force that we're putting together now to talk to businesses directly to understand better what their issues and concerns are. I've certainly heard from a number of businesses about their fears with customers not being there, and the impact it has on staff. What do we do with staff as it relates to EI? That's where the federal government has stepped up considerable commitments for employees as well to ensure people don't lose their homes or their apartments, and that has to be a major concern for us as well. In addition, you would have heard from the federal government recently monies to go to the women's shelters, and with the intention of being able to provide funds to expand the satisfaction of their needs around the COVID virus. So providing extra facilities, providing the assurance that there's monies in their budget to be able to accommodate swabs and masks and disinfectant materials, putting up barriers so that people keep safe distances. And that's another thing that Londoners do incredibly well. We do a great job of social distancing and self-isolation. I can tell you I'm currently in self-isolation, having returned rather abruptly from a family reunion that I had stateside. And as a result of that, I'm in isolation so that it's taking the appropriate precautions. And Londoners are doing that voluntarily. So again, I speak to the support that Londoners have shown through this and their forbearance in this unprecedented time. I think in all our lifetimes we haven't seen anything of this level. We don't know when it's going to end, but the more prudent we are, the sooner I think there will be an opportunity to have this dealt with. But I will tell you, it's important, Londoners' response, because where does one have an opportunity, as they have right now, to save lives? And as Londoners respond as they have, with social distancing and self-isolation, and when it's appropriate, working at home, when you see events canceled, when you see activities being curtailed or withdrawn from the community, it's absolutely with the concerns we have to protect Londoners, and the fact that by just following these guidelines, Londoners have that opportunity to save a life, and we just think that speaks volumes for Londoners' commitment and their heart. So we're trying to balance the actions that we're taking in conjunction with the provincial and federal governments with the response that we're receiving from Londoners. I will also add that our local MPs and MPPs have been tremendous. I've had daily discussions with them, as I have with a number of ministers whose portfolios impact our city at both the federal and provincial level. And I've been really positively impressed with not just how seriously they're taking the issue, but the support that they are putting forward. And more information continues to come out on that, and we'll ensure that we provide information to Londoners as that information becomes available to us. So it's absolutely a work in progress, but we've come some huge distance, and I need to thank our city staff who have been so committed to this process, all the member agencies and first responders, our hospitals, our chief medical officer of health, all the individuals and groups who have played their part in ensuring the safety of London and Londoners. So I will ask people to keep us in their thoughts and prayers as we go forward, and be safe. That's truly important for all of us. And if I said it once, I'll say it again. Thank you to London. Thank you to Londoners. You care, and that will show itself in so many positive ways, and I'm very grateful.